It was a baby step in New Jersey's return to normalcy.
When state and county parks reopened last weekend and golfing resumed, it marked the first time restrictions on public life were eased since the coronavirus outbreak began its deadly sweep in March. Governor Phil Murphy called it a huge test into whether the state could relax its near lockdown without reinvigorating a virus that has already killed thousands of residents.
The public passed that test with few exceptions, Murphy and his administration say, respecting social distancing requirements on a gorgeous weekend despite weeks cooped up at home. For 2 beautiful days, overwhelming compliance, was how acting State Police Superintendent Patrick Callahan characterized it this week.
But it is too early to declare victory.
Coronavirus resources, live map tracker, businesses that are open, homepage.
Whether the state's first experiment with reopening will lead to a new growth of COVID-19 infections remains an unanswered question, experts in public health say. And in the absence of more robust testing for the disease, that knowledge gap may continue to play out as political pressure builds for further, and potentially more risky, restrictions to be lifted as Memorial Day nears.
It can take 2 weeks for a person exposed to coronavirus to develop symptoms, meaning that jogger at Liberty State Park or hiker at Ramapo Mountain State Forest may not yet know they have been sickened. In the interim, they may be infecting others, the cascading effect that led to the virus spreading so quickly before the state closed down.
If we all went to the beach and played a big volleyball game, we would still be unaware whether that was good or bad for 14 days at least, said Henry Raymond, an epidemiologist at Rutgers University's School of Public Health.
Raymond said he has come around to the view that reopening parks was relatively low risk, since the outdoors offers a low transmission scenario, especially if people are staying apart and wearing masks. But once you start to open back up, it is going to be difficult to undo that, even if signs point to problems, he said.
I would hate to be the governor, because this is a hard thing, Raymond said.
How do we know if we are going too fast or too slow, he asked. I don't know.
On Wednesday, Murphy extended the state's public health emergency declaration for 30 days, saying residents need to continue to practice social distancing and stay at home as much as possible to fight a disease with no known cure or vaccine. Murphy did so as he continued to strike optimistic notes, saying the number of hospitalizations and infection rates continue to decrease.
Murphy held out the potential of further restrictions being loosened, saying the reopening of more retail business is among those on the list, though he did not offer specifics of how that might proceed.
What's the beach scene going to look like? What's that non-essential retail reality going to be? Murphy asked at his daily news briefing. What's construction going to look like? What's elective surgery look like? Those are all decisions that we have to chop through.
On Thursday, Murphy said he expects beaches to be open by Memorial Day, telling NJTV that he would be shocked if it didn't happen.
Stephanie Silvera, an epidemiologist at Montclair State University, said it makes sense for New Jersey to move incrementally, to test the waters and pull back if troubling signs develop. She predicted that if the reopening of parks leads to new infections, those would begin to be seen early next week with an uptick in positive cases and sick people showing up at hospitals.
Even then, rescinding the decision would be hard to do, given public expectations, Silvera agreed. As the state moves to further steps like addressing business closures, those will be even tougher to take back, considering almost certain pushback from the business community, she said.
If we're opening, it can't be open the floodgates and let's hope for the best and check back in a week, Silvera said.
In proceeding cautiously, New Jersey has tried to avoid the model of states such as Georgia, which has already allowed gyms, bowling alleys, hair salons and similar businesses to reopen their doors. Murphy has vowed New Jersey will make its decisions based on scientific data, and he has resisted setting a timeline, insisting that public health creates economic health.
Senate President Stephen Sweeney, D. Gloucester, has pressed for the state to move more quickly in restarting its economy. He says businesses should be able to resume operations, if they can follow Centers for Disease Control and Prevention guidelines for safety. Cape May County officials, meanwhile, have asked the state to permit them to incrementally open beaches, boardwalks, bars and other staples of the tourism industry over the next 2 months.
Dr. Joshua Corin, the chairman of Rowan University's Department of Family Medicine, said patients he is seeing through telemedicine are taking precautions to heart and want to do whatever they can to protect themselves and their families. Corin said it is important to be cautious, and to recognize that even the little things, wearing a mask around the mouth, but not the nose, in a supermarket, could contribute to the disease's spread.
The people I'm talking to are serious about it and they're asking me good questions, Corin said.
As the state further opens up, it will hopefully be done with guidelines that aim to prevent coronavirus from taking a new foothold, Corin said.
They are going to have to take bigger than a baby step and more of a stride at some point, Corin said, and our hope is that people won't take that as a sign to relax their vigilance.
Will that happen? Time will tell.
Our journalism needs your support. Please subscribe today to NJ.com.
Riley Yates may be reached at riots@njadvancemedia.com.